an alarm go off. Ah! Oh, this is off to a great start. Okay.
Don't cut that. Leave that.
That'll make the final cut. Hi, everyone. Novice Guard Dieter Schnitzel here with the City of Fountain Sisters. I have a couple of very special guests with me today. We're going to talk about part of the community that's really, really, really important to pretty much anybody who would require or need their services, and that is the KC Care Center. So first off, I want to introduce a representative from the KC Care Center, Mr. Russell Campillo. Hi, Russell.
Hello.
Thank you so much for joining me today. Thank you. And then I really, really appreciate it.
Absolutely. No problem.
Awesome. And then my other very special guest today is actually a patient with the KC Care Center. You know her, you love her, and that is our own City of Fountain Sisters. Cheese was fabulous. Sister Cheese was fabulous. Hi, Cheese.
Hi.
Thank you for...
People know me and love me, but okay, I'll take that.
People know you and love you. So for someone who is just watching this and doesn't live in Kansas City or doesn't know about the KC Care Center, can you kind of talk a little bit about it?
Yeah. KC Care Health Center started out in the early 70s as a just feeding, even housing for overnights, people to sleep that were homeless, and getting them health care that was very much needed. It was a totally different name, and it has had several names over its history. KC Free, KC Care Free Clinic. And it has now ultimately it's transformed into a federally qualified health center.
Awesome. So let's say I fall into one of those categories. Just kind of talked about what kind of services do they provide?
So some of the services that we provide are primary care. So we can do physicals, acute care for illnesses, well women visits, PrEP and prevention. We also do HIV care. We also have behavioral health, dental, and we have our own pharmacy, which I think is pretty cool. And then wellness and support services, like we do health education, nutrition counseling, dietary management, community health. Overall, we have a great group of community health workers, and each individual thing that I just mentioned has its own team. So we practice what's called the care circle. So for those individuals that I personally, this is where I started. So I had a case manager and the opportunity to have a peer educator, plus the doctor and a nurse, and all of these people are inclusive of that.
So can anyone, I have a job, I have health insurance. Can I make KC Care Center my primary care provider?
You can. KC Care has the ability to, now that they're a qualified health center, a federally qualified health center, you can actually use insurance. Even if you don't have insurance, you can come to KC Care and have your PCP there, or primary care provider. And we have a sliding scale fee. We can bill insurance for those that are out of care from HIV services and are interested in getting back into care and having those things done. You're welcome to come back in. You don't really need to necessarily worry about your income, because everything is adjustable.
That's amazing, and something you don't really find too often in this day and age in the American healthcare system. So I didn't realize that. That's amazing. So what is your role specifically with them? And then how did you kind of find them and get involved?
So my specific role is peer education. So I'm out, and I can only speak on my behalf and my experience. is as a peer educator, I am somebody who is living with HIV, who lives the experience of HIV. I've dealt with doctors, I've dealt with case managers, navigating insurance in the process of maybe making too much money. And so those experiences, and you can even include substance and recovery, that's my main gig. I'm very, very dedicated to the people that I serve in that aspect. We educate newly diagnosed with HIV people that don't know anything about it. So we teach them what HIV does. We teach them what a viral load is. We teach them what a CD4 is. We teach them, how to navigate these systems, which can ultimately be very, very complicated. How I wound up finding Casey Care is back when it was still Casey free. I was going there initially, and this is part of our prevention services, is we do outreach and HIV testing. We also do hepatitis C testing. We can manipulate our groups to actually get you other STI testing, so gonorrhea, chlamydia, and syphilis. And so I was a regular HIV tester. And I would go every 3 to 6 months. I'd have my HIV test and, deal with the whole 2-week waiting period and being scared and nervous and, being all of the things, having all the emotions. And eventually, that's how I started with Casey Care. And then I became somebody who was diagnosed with HIV. And then I was very clean cut, straight laced. I really didn't drink. I never did any drugs. And then I began with the substance issue or challenge. And then ultimately, probably about a year into my recovery is when I was suggested that I apply for a job at Casey Care. And I thought that I was volunteering for a position and I needed something to do. So I needed a job, and part of my recovery is continually being busy. Even if that makes me stressed out, I have to stay busy. That's why I applied for the job, and I found out that, I could actually get paid to do what I was doing, that I'm doing now. And here I am.
That's amazing. Thank you for sharing that, by the way. I know that was pretty personal.
Yeah.
I really appreciate that. That's, wow. We should all be so lucky to kind of have the path you did and then be able to wind up where you did. That's amazing.
And I think that's the biggest reason why I continue doing my job. I enjoy my job. I enjoy the people that I very much feel like I work for the people that come into Casey Care to see me. Mm-hmm. I might be, yes, labeled as an employee of Casey Care under that umbrella, but ultimately these are things that I do in my personal time. So I teach people about HIV, I talk to people about PrEP, and we talk about sex, and we have these conversations of, and just to be very blunt, one of the conversations I have had with people before is, what kind of sex are you having? Whether that's fisting, whether that's just masturbating, whether that's you're dealing with multiple people and you're into groups and you're using substances at the same time. I have these conversations on a personal level, and allow them to just understand that, I hope ultimately that if there is a substance challenge, and this goes back to why I do the job, is keep working through that, because eventually if you do that, and you're attentive to yourself and your body and your needs and how to, even if you don't know how to, that I will take on that role to try and help you get there. I'm
just kind of blown away right now. You put it in a nutshell. I think there's so much, you took a big topic and something that people might not feel comfortable talking about, but it's important to be frank about it, I feel, at times. And it sounds like that's something you're very good at. So awesome. can you tell me a little bit about the HIM project? Because I think that's what with us, the City of Fountain Sisters, that's kind of where we step in and support you guys. So can you talk a little bit about that?
So the HIM project is, it's all capital letters, but it is high impact men's movement. So, and what we do is our main focus is outreach HIV testing. Okay, it's a simple, it sounds very simple and uncomplicated. One of the things that we are currently in charge of is reaching out to Black and African Americans that are MSM. And MSM means that you're a man who has sex with other men, regardless of whether you're gay, whether you're straight and you have sex with other men, or you're bi, or you're poly, or you're pansexual, or, you know, whatever it is. So you have sex with other men of the same gender loving. So what we try to do is we're in charge of that particular outreach. So it's communicating with the Black community. It's trying to communicate with the trans community. It's, and I keep finding myself in this realm because I am basically labeled as a hybrid. So my primary focus is HIV services, and then my portion of my time through is paid from the HIM grant. And so we want to make sure that we are touching base. For me, it's asking questions of the Black community because I don't know. We see my shade of melanin, and I don't look like the Black community, but I will do, you know, my best to outreach to them, ask them questions. What can I be doing to make some changes? What can I be doing? We have other little subset groups that are also belong to the HIM project. One of those is the CAB, so that's the Community Advisory Board. We want to make sure that we listen. We're taking in the information from the Black community, from the Black MSM community in particular, and say, hey, what is it that you need? Where are your needs lying, and what do we need to be doing to reach that? You know, how can we fulfill that empty space that you've been missing for however long? The HIM project, we hand out condoms, we bring some to you guys, and you guys put things together and you outreach yourself, as well as we do it throughout the city. So I'll take condoms to Restart, we'll take condoms to, and we have a new person, his name is Casey, and he is excited and he's motivated and he's got fresh eyes and fresh ears and a fresh brain, and you know, I feel like he's gonna, you know, make a good position with the HIM project. So we're hoping that things continue to move forward, and we're able to outreach to the particular communities that, you know, that need it the most. Most of those communities are disparaged, which means, you know, maybe there's substance challenges, maybe there's financial challenges, maybe there's housing challenges, all of those things, and we just want to get people in care.
You guys do amazing work, and I talked to Casey a couple times now, so kind of something people may not know is I am, for the City of Fountain Sisters, like I'm the one who kind of touches base with you guys regarding the supplies we distribute. Casey, I feel like Casey's going to be a great addition with you guys, just in the couple of interactions I've had with him, for sure. I had no idea that was the extent of what you guys are doing right now. It's so necessary, especially with the way the world is right now, to kind of have that, for someone to kind of have that rock that they know they can go to.
To piggyback off of what you're saying right now, and something that I accidentally left out, we're currently doing, the HIM project is currently doing HIV home testing. We're using an OraQuick test, or OraSure, OraQuick, I believe. And so basically somebody is reaching out to us saying, I want to do an HIV test. So right now what we're doing is we are setting up a telehealth appointment with them. We are delivering a home kit. We're going through that home kit with them step by step, allowing them, and it may sound like a difficult situation to put somebody in to do an HIV test at home, because it can be dangerous, because they are physically alone, maybe without any support, but the test still needs to happen and they still need to know those results. and that allows for educated decision making in the process of getting that result. So what we're doing is we're actually delivering either by hand with a touchless, we're mailbox, porch, or we are mailing them out to people. And then we have that appointment together. We take the HIV test together, and then we move forward from that. So within that kit, it has information regarding PrEP, has information regarding community health work navigation, as well as HIV services, if that's what happens. So we're still, it's a little bit slower, or quite a lot slower, but the process takes a little bit longer, but we're still doing HIV testing that way.
Again, very important to know that resource is still there, especially when it might not. When you rewind a year, it was probably a lot easier to have access to something like that, for sure.
Yep.
Thank you for sharing that. So let's say they've heard everything you've said now. Someone watching this has heard everything you said now and say, I want to be a part of that. Like, is there a way that someone could get involved or volunteer?
We do have volunteer staff members, and that would it takes a couple of different steps. We have a volunteer coordinator named Debbie, who has a tendency to do a lot of work with universities, UMKC, KU, and people that are wanting to internship or externship and, move on with their career. As well as you can reach out to us and, ultimately, if we don't have the answer, we're going to find the answer for you, or we're going to put you in touch with the right person that has all of the answers that you need. So we have volunteers that come in that have the capability of being trained to do HIV testing. So they could attend outreach once a month or twice a month or however often they would like. We would prefer that somebody come in and, they're scheduled at least once a month. And then and be consistent, that's what we're really looking for. We need that consistent community connection. If you are a face in the community, whether that would be a Cheese Whiz or a Dieter or, myself, if I was not currently employed by them, we need some of that consistency. And I think that's kind of where we're having a little bit of a difficult time at this moment from volunteers is, yep, I'm going to come, but we're also in the state of unrest with COVID, and so we're trying to work through that as well.
Follow through. It's key. I'm with you right there.
Yeah,
absolutely. Well, is there anything else you want to add, or something I may have missed, or anything?
I think that basically covers it. I feel like I work with a great team of people, from the front desk staff to the MAs. I do have a couple of things that I want to pass along to you. We are doing outreach now, or excuse me, not outreach, but we're doing HIV testing at our Northeast location now, which is something that was not there before. And as most of us, because I live in this neighborhood and we have a high population of sex work. Sex work is real work, just FYI, in case anybody needed to know that. And we are currently providing free HIV testing on Wednesdays between 1 and 4:30 every Wednesday. If there's a change in that schedule, we will let the people that it's a very small office, but we have providers, and 3 different providers that are there, nursing staff, front desk staff. Everybody is part of the community, and they also excuse me, several of them actually live in the same area, so it's really helpful to know that when you walk in there that staff is from your neighborhood. The testing every Wednesday 1 to 4:30, and that's provided by Johnny, who is also bilingual, so he can do the testing in Spanish and in English. I think he can speak French and Portuguese too. So
Whoa.
He's multilingual, yeah. Like I said, we're still doing the home kit test. If anybody needs to reach out to us, you can email me, so russellc@kccare.org or kcu CASEY and the letter U at kccare.org. Also, we'll get the information to those who need it, and then move from that. I think the only other thing that's really for me left to be said is that, we're part of the community. Some of us have the experiences of substance challenges. Some of us have the experience of living with HIV. Some of us have the experience of being on PrEP. And, we want to hear from those people that are currently challenged with those things and have barriers to that care. So we're here as best we can. Show up. We're going to show up.
Russell, thank you so much.
No problem.
Sister Cheese Whiz, how you doing?
Great day, lovely weather, nothing to complain about. Yeah,
exactly. We're gonna and we're talking about something that's very important to all of us. So it doesn't get much better, right? How did you find the Casey Care Center?
I had a long journey that led me to the Casey Care Health Center. It probably started 8 years ago. I was living in Columbia, Missouri at the time, and that's when I got diagnosed with HIV. Luckily, when I was living in Columbia, I was actually involved in a group, much like the HIM Project. We would go out to the bars and we would hand out like the safe sex kits, and we would do education, and we would do little workshops and everything like that. So I was very educated about all of the different resources available to me at that time. So when I got diagnosed, I immediately knew the organization to reach out to. I got in contact. At the time, it was RAIN, like RAIN. That it was an acronym. I don't remember what it was, but they've rebranded, and they're currently Spectrum Healthcare, I believe. They're in Columbia. So I got signed up with a case manager there, and I got referrals, and I started going to see the specialty doctors at the hospital, and I got all that taken care of. I moved here to Kansas City, and because I was I had been involved in all of that education and all of that advocacy, I knew of the Casey Care Center. So when I moved here, they just transferred my case manager, and they transferred all my information, and I just slid right into the services here in Kansas City, and it's just been a nice, lovely relationship for the last 3 years that I've lived here. So
it really has seemed like it's been pretty seamless. It seemed like that was in something that was so necessary and important for you. Like, it seemed like it was one of the least stressful things about the whole process of getting from Columbia to here, basically.
It was an easy transition. I don't know if my case manager sent the information, or I don't know how that technically works, but yeah, I was immediately in contact with the people here, got set up with a new case manager, and got in for appointments, and
bing bang boom. Tell me a little bit about what your patient experience has been like there.
Going to Casey Care as a patient, it's been really nice. I feel like I get really good treatment. Everyone there is very respectful, very knowledgeable. They can answer any questions you have. I'm glad that it exists, and I'm glad that it's there for us, that they're doing the services that they provide to the area.
One thing that I've noticed about the Casey Care Center, in particular with you, is medical trials. So you recently wrapped up a medical trial, am I wrong?
At Casey Care, they have a clinical trial team, which their team actually reached out to me a little over a year ago, and they were saying they had a new clinical trial coming up for a new treatment, and they were going through all of their database of their clients and their the people that they treat there, and they said that I'm somebody who met their qualifications for this trial, so they were reaching out to see if I was interested. So I went in for a meeting, and they gave me this big packet of information, which I read through the whole thing. I thought it was really cool that their team is very proactive. They reached out to me and brought me in for this trial. So the trial was, instead of taking a daily oral pill for my treatment, I receive an injection once a month, and that was it. I was like, yes, please sign me up for that. I am all on board. So for the last year, I've gone to the clinic there once a month, and I receive my injection, and I get to live my life. The other 29 days a month, I don't have to take a pill. It's been over a year now. haven't had to do that. That's awesome. Like, I think it's really, really cool, the advancements and everything that's happening. Like, hopefully we get to the point where we have a cure for this and there's no more treatment, there's no more people who die from this. But these steps and these advancements, like, they're really, they really bring hope. So when they first reached out to me and they like proposed this and told me about this, like, I didn't even know that injections were like, I didn't even know that was something like that was being developed. So like, I made a Facebook post about like, oh, hey, like, I'm being considered for this trial, like, it's going to be injections instead of pills. And that post like blew up. There were so many people who responded to that, so many people who like reacted to it, and so many people who were asking questions that I was like, oh, like, it's not just me who thinks this is cool. Like, it was a light bulb moment where I realized like the importance of this. Yep. So like, that moment was definitely like a crystallizing moment for me going through this trial, where I was like, going through this trial, I need to be vocal about this. Like, I need to share my experience. I need to make my post, like, I need to make posts about this. So throughout the trial, every month when I've gone to get my injection, I take a little selfie with the doctor, the nurse giving me the injection, and I make a post, and I've kept people updated. I've just shared my experience because I realized how important that was going to be.
It's given a lot of hope to people, I think. It's and whenever we're out and about, people, it's usually one of the first questions people ask you. Am I wrong? Like, how's everything going?
Yeah, like a lot of people, like, when I see them out in public, which sadly for the last couple months isn't very often.
Right.
But yeah, like the first 6 months of the trial, when I would go out, manifested out to the bars, out to different events, like, people would be like, oh, how's it going? Like, what's the latest update? Or there would be people coming out of the woodworks that would like just have like a very brief private conversation with me, letting me know like, oh, hey, like, I've been living with this for like so many years, or I just got diagnosed a couple months ago, and like seeing your posts like really mean a lot. Like representation matters. Like, having these conversations and like taking these steps and being vocal about something, like the stigma is still very real. We've come a long way, but the stigma, like, there's still a lot of stigma wrapped around HIV and other health conditions. So being vocal about it and being proud and being loud and having those difficult conversations, like, it really changes people, and it really reaches out to a lot more people than you might think.
Thank you for sharing all that, by the way. One more question for you. What would you tell someone thinking about becoming a patient there?
Whether you're somebody who is living with HIV or not, absolutely, like absolutely, I recommend that clinic. I recommend any clinic, period, because you matter. Your life matters. Like, knowing your health, knowing your status, knowing what's going on with your body, like, you're worth it. You are very worthy of living a happy, healthy life. So absolutely, like, if you're on the fence about going to get just a checkup, or going to ask questions about PrEP, or going to get treatment for any condition you're living with, like, absolutely do it. Like, you are important, you matter, you're worthy, and you're worth it.
Sister Cheese thank you so much. Russell, thank you so much. Appreciate it. So guys, that is kind of the basis of, so if you're watching, thank you so much for watching. We will be doing, or I will be doing, it's part of my marathon training. This is who I am raising money for. It's Casey Care Health Center. Once this comes out, hopefully we'll have all the donation stuff up and running. We're gonna donate to that. You can donate to the City Fountain Sisters. We're going to make sure that everything raised from this particular video and kind of me talking about it the next couple of weeks, we're gonna make sure that gets into Russell's or anybody at the Casey Care Health Center's hands. Guys, thank you so much for watching. Russell, thank you again. Are you still there?
I am.
I'll see. Russell, I can't thank you enough. Yeah, I really, really appreciate it.
Absolutely. I think a lot of us that work within Casey Care and even volunteer, our hearts are in that place. And I think the majority of us have had somebody in our lives that either has HIV or has been affected by HIV, or has something that Casey Care provides care for. we're getting ready to have a trans focus group, which, you know, it's kind of a session. It's to find out what's going on, to hear the trans community, if you would like to be involved. So it's basically a feedback session, and it's October 22nd, 6 to 7:30 p.m. and or your choices are or October 23rd, 1 p.m. to 2:30 p.m. You can contact Corinne at Corinne K, which is CORINNE, the letter K, at kccare.org if you'd like to participate. There is you have to get the caveats to that are you receive care at KC Care, and you're a person of trans experience. And we want to know, like, what are some of the things that we can do? How are we doing in providing gender affirming care? And I think that question in itself starts from the time you walk into the door until the time you walk out of the door. We want to know what's going on with you. So, and we want to know what's going on with us, that you see maybe misidentifying somebody, I think is a big deal.
It is.
And either, you know, acknowledging it as one thing, oh, excuse me, I'm sorry, and utilizing their proper name or the proper terms, you know, so bring those things to the table. We want to know.
Awesome. Russell, thank you so much. Sister Cheese Whiz, thank you so much. And guys, I am less than 2 weeks ago. I'll be out on the trail, October 17th, 26.2. I can do it. We will be back soon with a new video. And thank you so much for listening today. And if you can, please donate to the City of Fountain Sisters. Thank you.